So I'm gonna give you some strategies if you've had some lingering outside ankle pain, whether that was from a sprain or if it is just something that's kind of been lingering. So the thing you wanna do first and foremost is first check the self-dorsiflexion test in our other video and make sure that you can get that knee about 10 centimeters over your toes and it's not pinching on the outside or the front here. If it is, first clear that motion, and then if your pain is still lingering, come back to this. But if that is good and your pain is primarily in that outside ankle when you turn your foot this way, then I'm gonna give you some strategies. So the first thing you can do is either work some self-massage or just use like the back end of a butter knife or a massage tool. And just work some massage there for a minute to 3 to 5 minutes. You can work it on slack and then also kind of pointed there. And you can even pin it as you kind of work it. This will work a little better kind of hanging off a chair or off a bed. Okay, so you kind of work that. Then you can also work kind of a self-mobilization. So you can take your fingers, cup them around this fibula bone here. You're gonna pull up and back, and then you basically can just mobilize that a little bit. Just kind of pulling up and back 10 times or so. The best thing to do is to pin it, stretch it. And this will hurt, but should almost feel better than when your hand's not there. Sometimes that bone can just get a little jammed up, and so just getting this can kind of free it up a little bit, okay? Then from there, you wanna get moving with it, and so what you can do is just work on some strength. So you're basically gonna rock up and out, up and out. And you can do that single leg. And so normally our heel raise would be straight up and down. We're just trying to kind of work and challenge that painful range of motion there. So you can kind of challenge that. And then if the pain's still lingering and that self-mobilization kind of helps, you can do a self-tape technique. So you just take athletic tape, go backwards, and you can rip this kind of in half lengthwise to kind of make it fit a little bit better. But you basically get it to that length where it's gonna spiral around. And then you place it, ideally you want to dorsiflex your foot. So you place it there, take your tape, put it right kind of at the top of that bump there, and then you're gonna self-mobilize with your hand up and back, and then you take up that tension with the tape, and then you lay it down. And sometimes you have to lay down a second one. And usually this feels pretty sweet, and you go and you do the pointing thing, and it fights you a little bit, but it feels better. And then usually after a few days of wearing this, sometimes you have to reapply it. You take it off and you're usually feeling pretty sweet. Sometimes you have to re-hit it a little bit with some of the self-massage, mobilization stuff, but that usually clears. If you're trying these things and it doesn't clear, then there's a chance just that actually things are over-lengthened a little bit. It'd be good just to see your PT and just kind of have them assess and scope things out, and they might have to give you just a little bit different direction. And also just make sure that that dorsiflexion is clear first. So make sure dorsiflexion is clear, hit it with these, and that should kind of make the difference. Use the tape if you need, and then if not, then definitely check out, see your local PT, and they can kind of help you assess and further fine tune in a way that's specific to you. So hopefully that helps with that outside ankle pain and gets it cleared and gets you going.